morning anymore. Madam Chair, County Commissioners, County Managers, staff, and public. My name is Yoli Diaz, Executive Director of Cancer Aid Resource and Education. I would like to begin by saying thank you for amending Doña Ana County's Healthcare Assistance Program. You can't have quality of life if you can't access healthcare. As you know, I've been advocating for access to healthcare, including cancer treatment, for some time now. I also want to say thank you for including the section of cancer treatment coverage in the county's healthcare assistance program, since this was a gap of healthcare service to the most vulnerable population of Doña Ana County. I believe that this is a good faith effort on behalf of the Board of County Commissioners. On a positive note, I believe that Doña Ana County has now taken a 180-degree turn and that it has set precedents with adding cancer treatment, which was needed to provide a solution to some health disparities and inequities. For this, I am very grateful. Regarding the resolution, I would like you to consider the input of possibly 2 items. 1, the major of the gaps in healthcare services is diagnostic testing. I would like to see that this language is added. Some of the residents I have assisted have included that residents have issues in receiving diagnostic testing and that they are uninsured. Please consider that treatment works best when cancer is detected early. Detection of some cancers at an early stage combined with prompt treatment permits less aggressive treatment, leading to a better quality of life of the patient, and is associated with significantly reduced mortality. 2, on item 2, the process section E, if it doesn't cover this, please consider another item. Another issue I have seen is that some residents have long waits in getting appointments. I believe that the consideration for any provider that provides both diagnostic testing and cancer treatment needs to be considered. The true reason some residents have not accessed the care they need when they need it is due to being uninsured, underinsured, the cost, whether not being able to pay at all or not being able to pay the high cost of the estimate. In other words, unaffordable. Thus, the first barrier of cost is solved in the resolution. That's the big one. Prompt treatment may involve the consideration of any provider that can provide the treatment and be paid the Medicaid rate, because at the end of the day, we're talking about the same cost. I still believe that there is work to be done. My concerns include the knowledge of this problem in accessing healthcare in the first place. In 2011, there was a community-wide effort in Doña Ana County to discuss the challenges in implementing the Affordable Care Act in Doña Ana County.
Expired.
I can't keep talking. I thought if it was an item, I could say it.
3 minutes.
Really? I thought it was going to be allowed more because I have a heck of a lot more to say. Do I have to continue this?
Ms. Diaz, I'm happy to meet with you outside of the commission meeting and discuss some of your recommendations.
Okay, I'd be happy with that, but I'd also like the commissioners to know. So what I can do is probably, because I do want this to be public, because I think it's very important, especially with the other issues that we do have, because there's still issues within the lease. And I really want you all to hear what I have to say. So I will continue it. I'm happy to meet with anyone to be able to improve health outcomes in Doña Ana County.
Thank you, Ms.
Thank you.
Appreciate your time. Commissioners, any other questions or comments? I do have a comment, and I need to thank Ms. Michaels and her staff, because I think this is an important step to the county moving forward. Is it a perfect plan? No. Is it an excellent plan at this time? Yes. And we do it little by little, working together, listening to the public, and coming before this commission and having thoughtful and well-rounded conversation. So Ms. Michael, to you and your department, great job. Thank you. Anything else, Commissioner Reynolds?
Thank you, Madam Chair. Ms. Michaels, The comment that Ms. Diaz said about adding diagnostic testing to this, I actually think that may have some merit. What are your thoughts?
Madam Chair, Commissioner Reynolds, it is difficult to prioritize the type of healthcare services that people may need. When I talk to emergency department staff, they say dialysis is the top of the list. When you talk to, it depends who you talk to. There are so many unmet needs in our community that we really are in a position where we have to use our resources the best we can and unfortunately prioritize. So my recommendation would be to let's give this some time to see how many people are in need of cancer care and how much that is going to cost the program, and then look at what ability we have to add different services over time. We also, through the relationship with Memorial Medical Center, they do cover quite a few diagnostic testing. We do reimburse the federally qualified healthcare centers for primary care, and that can include some testing. We also, I will confirm with the New Mexico Department of Health, because they've had programs in the past for specific types of cancer screening. So I think learning more about what is already available first before we add a longer list of services. We're already spending over $10 million for the healthcare assistance program each year, and at some point we do have to prioritize. The other thing I would say is I think our greatest, so to meet all of these gaps, I think the greatest thing we can do to help people is to help them get back on Medicaid or purchase insurance on the exchange, because then they do have comprehensive coverage. This program is never going to be comprehensive and meet everyone's needs. But if we can get people on Medicaid or get people insured through the exchange, then they will have comprehensive care.
Yeah, thank you. This makes me think about something else that I should have thought about, and I have thought about, just not till now, about how extensive it could be. Is it possible that you could actually prepare a presentation for us, giving us a kind of a breakdown of how the medical situation is today? I mean, i.e., how many, I know the percentage of people who have diabetes is like in the 50% or something like that, or better, and ages. Is there some way you could do a presentation to prepare us to understand a better, clearer picture about what the challenges are in healthcare in the county, and what the, I know what the resources we have, the resources being used. You might want to do it with another organization, I don't know, LC3 or something, but it'd be nice to have a one meeting where we can actually say, this is kind of the state of healthcare in the county. This is what the city does. This is what the county does. This is what the state does. This is what the federal government does. And then help us to understand ways that we could possibly increase our ability to do a good job of mapping out the coverage. And as you said, use our resources wisely, to cover the most important things. And I'm not sure that I'm educated enough in this area to make really good decisions or even make good recommendations without your advice, Yoli's advice, and other people in the community. So I'd love to have a half an hour presentation on exactly what that profile looks like for the county today.
And if I just may, Commissioner Reynolds, because I don't think I understood perfectly, are you asking for a presentation based on the top 10 medical issues or across board? I'm not understanding.
Thank you, Madam Chair.
And I apologize.
No, that's a fair question, because when I think about...
Because there's so many diseases out there.
Exactly,
I'm just thinking what you're requesting Ms. Michaels to do. And
when I think of the community, I mean, there's a couple of things that we can look at and go, yes, that's a problem. Diabetes is one of them. It's hard to ignore that. Kidney disease is one of the things that actually is caused by diabetes. And then, so we look at the root cause of the problem, which is diabetes, and then how do we actually test for diabetes? Well, we do an A1C test, and if you can test for diabetes and get your A1C under control, then generally we don't go down that route. So I guess that's the kind of profile I'm looking for, is what are the top 10, maybe what are the top 20, where's the money going, basically? Where are the resources going? Where are the resources needed? Okay, basically where they're needed, where they're going, and let's deal with what is the prevailing challenges that we have so we can see those. If they should fall in the top 10 or top 15. But there may be some minuscule thing out there that only happens in Doña Ana County, like uranium poisoning or something, okay? Because we know that's all over the place here. So if there's something that is unusual, then yes, we talk about that, even though it may not be in the top 10, but it may be prevalent just in this area. So yeah, I would like to have a presentation on that, so to prepare us for these kind of discussions where we can participate more intelligently. Okay.
So
knowledge, we maybe not intelligently, because intelligence and knowledge are not the same thing. Maybe more knowledgeably anyway.
Right, so the top 10 health issues in the county?
Yeah.
Okay.
And kind of profile that for us.
So,
Thank you.
Madam Chair, thank you for the clarification. Commissioner Reynolds, we do have primary data, which is data that we collect directly from the healthcare providers for the population of people who are served under the healthcare assistance program. So there is, I think, about 5,000 people enrolled in the program, and Norberto's data can tell you why they go to the doctor, why they seek primary care, dental care, or behavioral health. So we can give you that primary data that describes the demographics of the population. So the 5,000 people, we can tell you most are men, most are this age. We can give you that type of information, which I think is, because that's the subset of the population that this program is trying to serve. The healthcare assistance program isn't serving the entire population, but we do have a state of health report that we produce with the local health council. And that does give, I think it gives the top 5 morbidity and mortality. And it also looks at health equity. So it looks by zip code, where are the greatest years of life lost in our community. So if I can start by sharing that report with you, both the county's healthcare assistance program report and that state of health report, and maybe from there you can give me some direction on what you would like to see, or maybe the information in those 2 reports will answer your questions.
Thank you.
Does that suffice, Commissioner
Well,
Reynolds?
I was going to say the only thing. I'm sorry?
To begin with?
Well, the only thing that's missing from that is actually where the money comes to pay for those services.
Mm-hmm.
And I think that's also something that what resources do we use, and what do we allocate? What does the state government provide services for? What does the federal government provide services for? And what are the gaps in that? So I think if you took what you're talking about there, you map that over the resources that are available to treat those and deal with those situations, I think that would be the picture I'd be looking for, is to take it one step further so I understand financially what kind of burden it is on the county and other resources that we have in the community. I think that would kind of complete the picture. Okay, thank you.
Thank you.
Thank you, Commissioner Reynolds. Any other questions, commissioners? Thank you. May I have a roll call vote, please?
Commissioner Murillo?
Yes.
Commissioner Reynolds?
Yes.
Commissioner Sanchez?
Yes.
Vice Chair Shaljo Hernandez?
Yes.
Chair Chaparro?
Yes, motion carries unanimously.
This item does have a resolution number. That resolution number is 2023-67.
Thank you, Brandy. We'll move now on